Wednesday is International Transgender Day of Visibility, highlighting contributions of the transgender community. President Biden issued a proclamation saying in part, quote, "In spite of our progress in advancing civil rights for LGBTQ plus Americans, too many transgender people, adults and youth alike, still face systemic barriers to freedom and equality. The Biden-Harris administration is committed to fulfilling the promise of America for all Americans by stamping out discrimination and delivering freedom and equality for all." This week, Arkansas lawmakers passed a first-in-the-nation bill restricting medical treatment for transgender youth. It's now up to Republican Governor Asa Hutchinson to sign or veto the bill. The measure would ban doctors from providing gender-affirming treatments such as puberty blockers, hormone therapies, and transition-related surgeries. Medical organizations are speaking out against the bill and similar ones in other states as dangerous to an especially vulnerable group of children and teens. A study published in the medical journal Pediatrics last year found transgender adults were significantly less likely to have suicidal thoughts across their lifetime if they had access to puberty blockers, which help slow down changes in an adolescent's body. Samantha Schmidt joins me now with more. She's a reporter covering gender and family issues for the Washington Post. Samantha, welcome. Thanks very much for being with us. So you spoke to both the parents of young transgender people in Arkansas and the state's only openly trans elected official. What do they fear the impact of this law will be?
Yeah, we've heard from parents and students across the country, and there's really a huge concern that this would have dramatic impacts on the mental health of young transgender people. Puberty blockers are widely recognized as a temporary and potentially really beneficial way to pause puberty from making potentially permanent changes to transgender young people's bodies, and they are temporary and reversible, and a lot of transgender young people rely on them. And there are studies showing that this can help prevent suicide and other detrimental mental health impacts of that young transgender people face. And this bill would also take away a lot of insurance coverage of these treatments. So there are really potentially massive impacts.
Well, Arkansas is not alone. According to the Human Rights Campaign, Republicans have already introduced a record 127 bills on trans issues across 22 states this year. Where is this push coming from?
We've actually seen this come up since early last year, and even in late 2019, we saw Republican state lawmakers across the country start to push these bills seeking to restrict medical treatments for transgender kids. And we saw groups such as the Heritage Foundation and Alliance Defending Freedom really taking on this issue. And it also kind of started with this high-profile custody case in Texas in 2019 that centered around a transgender 7-year-old child. And so suddenly we see many bills across the country coming up about this. We see, national politicians bring this up, such as Senator Rand Paul, bringing this up in a confirmation hearing for Dr. Rachel Levine, who is now confirmed as the Assistant Health Secretary and is the highest-ranking transgender government official. And it's showing us that there's, this has become a major issue for conservatives. There's a lot of misinformation spreading, such as this idea that young transgender kids are getting surgeries, or that young prepubescent transgender kids are getting access to potentially irreversible hormone treatments, which just isn't true. We know that before puberty, transgender children only socially transition. Current medical guidelines do not recommend surgeries or hormone treatments for very young transgender kids. And, there are very established medical guidelines from the Endocrine Society, from pediatrics across the country, who say that puberty blockers are beneficial and are reversible, and that they should be accessible to young transgender kids once they reach the age of puberty.
how do these assertions, Samantha, from politicians that these bills are about protecting children and teens actually line up with what transgender people themselves say about their own experiences?
Yeah, trans kids these days are coming out earlier and earlier. And we know that when a transgender child goes through years, months of appointments with therapists and doctors, that they find that puberty blockers can sometimes be life-saving, because if you're a transgender child and you've known your whole life that you are a girl, for example, and you want to prevent changes happening to your body that could really impact your mental health the rest of your life, puberty blockers can help that happen, can put that on pause, and allow them to live fully as themselves later on in their teenage years and as adults. And by taking that away, doctors are taking away that time that they can pause and think about what they want to happen next to their bodies, because you can always stop taking them, before moving on to that next step. So, transgender kids are already extremely vulnerable. We know that they have much higher suicide rates than the average young Americans, and there's really concern that this could just increase those mental health issues even further, especially in a pandemic, knowing that so many transgender kids are really isolated right now and really struggling.
Yeah. Well, while we have you here, I also want to ask about the Pentagon reversing Trump-era changes that banned transgender enlistees and issuing new rules for their medical treatment. What do we know about this?
Yes, my colleague who covers the military has been covering this for the most part today. But yes, this is, of course, repealing, making official the repeal that Biden issued early on in his administration, one of many moves he made to expand the rights for the transgender community. And this would, repeal the ban that Trump issued during his administration against transgender troops in the military. So this is basically giving that stamp of approval, allowing transgender troops once again in the military. And like I said, it's one of a number of actions that President Biden has taken, including an executive order on his first day in office that expanded protections for transgender and LGBTQ Americans across federal government.
All right, Samantha Schmidt. Samantha, thank you.
Thank you so much.